I took a picture on that and I didn't actually it up.
And you know what?
Yeah. Sometimes they have public.
Yeah. So it's been a little while since I've been here, and Ryan asked me to bring to you an update on the status of the opioid crisis in the community. So I sent around copies of the PowerPoint as well as a handout, a public service handout that talks about preventing an opioid overdose that came from the CDC. So as you're looking at it, so I thought I'd start with a little bit of background information. Essentially, when we talk about opioids, we're talking about three main types. The first one are natural, and you've heard, and they come directly from the opium poppy, and that would include morphine, codeine, and thebaine. Then you have a semi-synthetic, which is a combination of man-made and natural, and you've probably heard about this on the news. Hydromorphone, hydrocodone, oxycodone, OxyContin, as well as heroin, which really is derived from morphine. And then you have the third category, which is truly man-made. And these are fentanyl. There's been a lot of information about fentanyl in the media recently. I want to say yesterday, somewhere across the border, they had a significant amount. They recovered fentanyl coming in across, I want to say, the southern border, and they intercepted that, like a huge amount. Yeah, and that was yesterday. In addition to the fentanyl, you have the pethidine, the levo, I can't even pronounce that, methadone, tramadol, and dextro, which I think is Darvocet. But anyway, I can't even spit that stuff out. But I mean, you've probably over the course of time either been prescribed it for a dental issue or a orthopedic issue. So some of those drugs are some that you might have taken or got your prescription filled. So those are what we're kind of talking about when we're talking about opioids. And what do I do?
The right one.
There you go.
Now hit the right side.
Thank you. So how does an opioid overdose occur? Clearly there's opportunities where the patient or the consumer deliberately is misusing it. They're using heroin, and as their tolerance grows and grows and grows, they find that they're trying to take more and more of it to get the same high that they got. Unfortunately, the body gets to a point where the lethality of it is at a certain level. So you have the addict that's misjudging how much they're able to take, or it might be cut with something that makes the high even more intense. There's obviously times when a patient is taking it as prescribed, but the prescriber made an error in judgment. And then, depending on the subject and why the person is using the heroin or the opioids, they might combine it with another drug. Many times, people that have an opioid addiction will abuse other substances to kind of manage the highs and lows of the drug. They might take something to pick them up. They might take something to take the edge off. They might combine it with something. And unfortunately, sometimes these combination drugs can have very bad outcomes. So who's at risk? Anyone that has been using it for long-term management, because as I said, over time, a person develops a tolerance and they consume more and more to get the same effect. Individuals that are using or misusing prescription pain relievers or heroin, those that have been recently discharged from emergency medical care following an opioid overdose. You might have heard that when a person is revived from an overdose, depending on how that happens, it's a very uncomfortable process. And the person is now in withdrawal. And many times, not many times, most times when an addict is looking to use, they don't want to be sick anymore. They just don't. So here they are, they've gone to the emergency room, they've had this horrible event happen to them, they're feeling even more miserable than normal. Somebody that's recently completed an opioid detoxification or has been abstinent for a period of time. There is a theory or background that once a person has a time of abstinence, and if the person chooses to return to use, they will use at the old level, and their body isn't used to that. And that's kind of a bit of shock to the body. And then somebody that's recently been released from incarceration. They were white knuckling in, hopefully not using while they're incarcerated, but they get out and they want to go back to the lifestyle of addiction. So what are the signs and symptoms of an overdose? Small constricted pinpoint pupils, loss of consciousness, falling asleep. It's referred to as nodding out. So literally you'll have somebody sit in a chair and literally going like that. Very slow, shallow breathing, choking or gurgling.
I'm there.
I'm so sorry about that. Sorry. Well, we're going to get to what happens afterwards.
I want to know. I need to know.
You got that beat down or stabbing?
We're going to get there. Hopefully not choking or gurgling. A limp body,
I'm moving.
or really, really advanced, you're looking at pale blue or cold things, blue skin. So what do? Call 911. You might be a person that's gone through a Narcan training. Naloxone or Narcan is something that can instantly reverse the effects of the overdose. And again, that's extremely shocking event to the body, because literally with administration of this medication, literally kicks the drug that's attached to the neurons, the receptors, kicks it right off. So you're under the influence and then you're not under the influence. And it's a miserable process. And yet people continue to, and unfortunately sometimes it takes more than one dose to bring somebody around, depending on how much they've consumed. Got to keep the person awake. You're trying to keep the person awake and breathing until help can arrive. You want to lay the person on their side and to ensure that they're not choking, and stay with them until emergency workers arrive. So now I'm kind of going to get into some statistics. So what now you're looking at is from December of 2018, you're looking at the trend. The blue bars are the opioids, the gray is males, the gold is females, and you're going to see from 1999 up to 2017, the number among all ages by gender of overdose deaths involving any opioid whatsoever. So any of those drugs that were noted on my first slide are in this category. So you can see that we've been trending every year a little bit worse than the year before. So now I'm going to drill it down to Lewis County. And what I can tell you is that since 2014 or I guess for me it's 2015, Leanne Mosier, the district attorney, keeps track of these numbers. The overdose deaths as well as the suicides in the county. So you're looking at the numbers that I have available. These have been supported also by the Department of Health. It also started tracking this data. So we started 2014, and we go and we really kind of averaged about the same one until the last quarter of 2017, where we saw a spike of 17 deaths in one quarter.
Seven.
So, thank you, sorry. Ben. 7 is a total of 17 that I had. But anyway, so we had 7 deaths in that one quarter. And essentially if you talk to anyone that's involved, the only thing that they could identify as a potential source of that was the fact that for whatever reason we had a bad batch of heroin available to our addicts. And I've had people talk to me about, well, why, if somebody's died and you know that's the dealer you got your heroin from, why would you go to that dealer? You know, if that is what you kind of assume happened. And unfortunately, in the addict, that's kind of what they're looking for, because that death isn't going to happen to them. They're looking for that high that they got, and they'll go to any lengths to get it. So they see that while that poor person here died of the overdose, it's not going to happen to me, so they'll actually seek that dealer out, which is kind of a part of the addiction process in mind. And since that one little spike, we've really been averaging on 2 to 3 deaths a year. And actually in 2018, I want to say that we dropped even lower than that. We had a couple of quarters where there's been 0.
What do you feel there's a reason why it dropped
it because Narcan became more available for groups of people to have?
Okay, yeah, we're done. This is the trouble with one data set. And what they also track, and it's not for in regards to Lewis County, and I'll get to that, I think if I include that, but the other thing that Department of Health also requires is that the number of Narcan administrations within the county by the EMS or the police department. So they are tracking that. But there's
Because anybody can get,
anybody can get it.
anybody can get that.
Yep. In fact, there's some drug companies that if you are on a prescription opioid, you get
With your prescription.
with your prescription and instructions as how to have that. And again, it's not necessarily, and people were offended by that because they're thinking, well, I'm not an addict, I'm not gonna overdose. But the mindset is that many, if you've got that prescription in their house, there might be somebody stealing it from you.
Yeah.
Or somebody within your household that is at risk for the overdose, and you certainly would wanna have that available. And it's pretty simple to administer.
Do you think it has anything to do, the spike is one thing, but the fact that if you look at even the quarterly numbers that we just received, I don't know, like 2 weeks ago, we're at a good trend now. Do you think that that's a trend in drug use has shifted away from that a little bit, or what's your opinion on that?
So from what I understand from the treatment facilities is that while we have the reduction in the opioid use, we're seeing an increase in the methamphetamines. So what I've been telling people is that, Lewis County has a substance abuse issue. And right now, the drug that most people are concerned about, especially those that are seeking treatment at Credo, is the methamphetamines and alcohol use. That seems to be what's bringing people to treatment. So, to Greg's question, what we can tie that back to is what we don't know. So we had a reduction in the deaths, but what we don't know is how many people have a substance abuse problem, how many people were quickly put into treatment. There's so many things that you'd like to be able to say, I can tie our reduction to these mechanisms, but we have a difficult time finding that kind of data and be solid on that. Because a lot of times, and I'll get to the OASIS data, which is Lewis County specific, there's so many things that can get in play in that, that you don't want to take ownership. You don't know that that's exactly what happens. So this is information that I got from OASIS, and it's time between July 1st, 2017 to June 30th of 2018. That's the only data that they felt comfortable giving to me, that it was solid in their data banks. So essentially what I asked them to do is how many individuals that were Lewis County residents, and they keep track of people by their zip codes when they enter a OASIS treatment facility. So I wanted to know how many had been admitted, and what they did is they broke it down. There was, I want to say, 72 Lewis County residents between that time period that were admitted into some sort of OASIS treatment facility, and then they broke it down by types. So the first, and then the orange is primary heroin, the darker red is all opioids, and then the green is just prescriptions. And the treatment facilities that our Lewis County residents sought during that time frame were residential programs. So that would be a residential program where somebody's living. It could be acute, inpatient treatment, meaning that they're like the farm at Credo, meaning they're there and they're getting intensive treatment while living there. They could also be in a halfway house, meaning that they've gone to the next step, they're living in an OASIS residence, and are having the support of having that housing. Outpatient services, our provider here is Credo, but again, it could be any OASIS provider in New York State. Opioid treatment programs, and I'll talk about that in a minute. Those that are admitted to an agency that provides methadone, buprenorphine, and things like that. So they're providing that medication treatment to the opioid dependent person. Then you have inpatient, which is an acute stay, typically anywhere from 14 days to 28 days, and then crisis. We don't have many crisis aspects here locally.
But it looks like from that chart, the majority of the problem is illegal use of heroin and non-prescription opioids.
Yes, and essentially that comes down to the fact that heroin's cheaper. Last time, and this isn't wild, so don't take this to the bank, but my understanding, if you were getting the prescription pills, it was like $10 a milligram is what you're paying for a pill. So you've got a 50, if you've got a 50 milligram tablet, you're paying $50 for one pill, and they're able to get more bang for their buck with the heroin bags.
Heroin isn't in pills. It's
No,
on the
right. Yeah, they're
street,
shooting.
right?
Yep. But you can buy, I mean, when I talk about any of these opiates, you can buy them off the street from the same dealer.
Pat, I would say it's surprising to me that we had 72 individuals over that period of time. Now that's 1 year, but 72 residents of our county seeking treatment of some kind is
But 55 of them were from heroin.
right. I guess that's surprising to me.
Well, it was hot and heavy for a while.
Yeah.
I didn't think it would be that readily available.
Yeah, it is. And in fact, I recently had a school meeting in regards to the drug houses that the school district was aware of. It was very interesting to me.
Where do they go with their inpatient, Pat?
Typically, depending on, it all comes down to your payer. So depending on what kind of payment that you have available to subsidize your treatment, those that have no insurance can apply to St. Lawrence, which is in Ivensburg. Those that have Medicaid or private insurance, Medicaid are typically your Canton-Potsdam hospitals. There's Canton-Potsdam that has a rehab, several in Syracuse. So those are rehabs. We have residential programs in Jefferson County. We have the OTP in Jefferson County. Inpatient people are going out of county, and regardless of whether it's detox or inpatient unit. And I can tell you that when I try to connect people to detox units, they're on a waiting list. They are waiting, and they're white knuckling it at home because because the demand is more than the beds, to the point where Department of Health and Oasis issued a waiver to hospitals that would allow them to have detox beds without going through that, jumping kind of the hoops, and it was trying to respond to the long wait list for detoxification. So how do we respond? So for my office, community services is required to produce an annual service plan that involves all our subcommittees, the community, our community-based organizations. And opioid abuse has been a problem in each of the plans since I've been here in 2015. Mountain View Prevention and the UP Coalition, which used to be the YAC Coalition, they applied for and were awarded the 5-year drug-free community grant, and for that process they had to identify what populations they were going to target, and they also chose opioid abuse as one of the areas. We had, right after the spike of opioid deaths, we had 2 grassroots efforts that are still going on even after 2 years. And that is Lewis County Drug Addiction, it's real and it's local. That's in the Port Leyden area. And then the Project Safe Community, which is in the Harrisville area. And they actually, Project Safe Community got their 501(c) and became a nonprofit. Very active up there.
Hey, Pat, before you said you got the data by zip code, could you drill down even further and see the hot spots in Lewis County?
No, because it's their residents.
Gotcha. And that's gonna be hidden.
Yes, yes. And I think somehow Jefferson County was able to do just what you said. And there is some sort of system they tied into, and I'm not sure about that.
I've got something from NISAC on my desk, so
Okay.
we'll talk about it.
Okay. So the other thing that was responded to is that both Credo and the Behavioral Health and Wellness Center offered walk-in appointments, meaning that if you got a crisis, you could walk in and they would be able to see you. They would just have you sit and wait till somebody's available, but they provided that. Northern Regional Center for Independent Living employed 2 recovery coaches. Those are peer recovery coaches that went on to get a peer recovery credential. I wanna say that right now, neither one of those, they don't work there anymore, but they're now, educating a new person to get that, designation. And then they also implemented a warm line. So when I said that when you had a person waiting to go to some sort of care, the warm line would be a phone that you could call, and somebody would be able to talk you through if you're kind of struggling, or kind of give you support until you could get where you want it, where you're supposed to go. Mountain View Prevention Services with the, I can't think of the organization, but they partnered with an organization in Watertown that name's escaping, and provided several free Narcan trainings to the community. Credo Community Center opened their opioid treatment program, which is housed in Watertown, and they prescribe methadone, buprenorphine, and I want to say Vivitrol through that. And then the Lewis County Suicide Coalition has certainly worked to make the community aware about treatment and reducing stigma. So this is the closest opioid treatment program that we have. That's a Credo Community Center. And essentially, in addition to somebody going and getting the prescriptions for those things, oh my goodness,
Nice.
awful. Oh, perfect. In addition to the medications, they provide group and individual counseling. Basically, you just can't go get your prescriptions. You have to participate in some sort of service. Case management services, vocational, educational counseling, discharge planning, evaluation and assessment, and I put group and individual. They do a lot of group and individual counseling. And right now, as of last week, there was 19 Lewis County residents in that program. What's going on in 2019? So community services, there's certainly been a huge amount of money that has been thrown at this this problem. And it starts with the federal government, and then OASIS, Office of Alcohol and Substance Abuse Services, has been parceling out the money. So right now, we have several things in the works. A HRSA grant, and that was the Rural Communities Opioid Response Program Planning. And essentially that is a federal grant that is working with our prevention organizations, Mountain View Prevention, Pivot, and Seaway Valley. And the first year of grant funding is for planning. What is going on in your community? How can we enhance services? And how can we fund that going forward? I believe that we'll hear about that in the spring. We have the SWORD grant, and this is jail-based SUD program allocations. Lewis County got an award, and we've already worked with Jefferson County to put additional programming in the jail. So we're working with the staff in there and the sheriff. We're also in a potential NIDA grant. This is a healing community study, developing and testing an approach to address the opioid crisis. Lewis County, the data set that they looked at is they looked at the 2017 data. And as a result of that, put Lewis County as one of the counties that were identified. Right now, the NIDA grant has been submitted to the review committee, and the next step is that there'll be visits to each organization. I think there was 21 that sent in for the grant to determine how it is, what our grant numbers were, what our plan was to put the utilization, and how we felt that was increase the assistance to this problem in the community. So more to come on that. And also this PAX game is right now a Department of Ed is encouraging and working with OASIS to implement this PAX game in our school systems. And they've been able to actually identify that this does have evidence-based to reduce developing an opioid use disorder. So there's money for that. Essentially, you know, what do we got going for us here? What do we have to be worried about and things like that? So Lewis County overall, we have basic services, but we do have them. We also have a wide variety of community-based organizations. We have partnerships between our organizations willing to work together. And, you know, the size of our county and the familiarity between the stakeholders is a plus because we can get things done quicker and we know who we're talking to. Weaknesses, we're always challenged in attracting and retaining qualified staff. So if you get green staff, that impacts the care that people get. It's just because they don't have the breadth of experience. We have limited access to specialized services. So if it's specialized, residents are gonna have to go out of county. As I said, our workforce is green. While we have improved transportation options, we still are limited. We have a poverty and lack of employment and lack of a housing stock. Opportunities, strengthen partnerships between the agencies, community-based organizations, health systems, and school districts.
That's something that we've been working on. Pat has started a regular meeting with Jenny and some of the agencies with the school districts to make sure that we're all working from the same book.
Yes. Improve the, again, I think that we're working on is recognizing the problems and making referrals from the school settings. We are also working on workforce and partnering with JCC, developing a frontline worker certification, and I said improve, and apparently I lost my thought. So, threats, we've talked certainly about the legalization of recreational marijuana. That's certainly something that we have to consider as we go forward. There's going to be a shift in funding for our agencies. It's hard for agencies when they're a one, agency shop, when much of the funding is geared for large health systems. And we continue to have a significant substance abuse problem in the county. Does anybody have any questions?
I have one, Pat. We've talked about this before in the group, and it may have changed, but one of the indicators seemed to be insurance companies was only set up for 2 weeks, and it ended, and we never really accomplished what we felt we could accomplish in that state. Is there anything as far as the state, whatever, with insurance companies, to get a longer time to maybe when these people go through these programs, they're not necessarily cured, but they have a better chance of not being back there again?
So Oasis did go back to some of the providers, and I think the ones that they have influence over, like the Medicaid managed care companies, and they eliminated the need for pre-authorization so that people can get in quicker. I haven't seen too much on the length of stay in regards to somebody that's at an inpatient unit, and you're right, it's 2 weeks and you're cutting. It really was more influencing, making sure that you weren't saying you weren't going to take people. They're making sure that that you're not turning people away, especially pregnant women, high-risk HIV users and things like that, but not necessarily the length of stay when somebody's away.
I mean, is that still
It's still
the
problem.
group's feeling that if there was a longer stay, it might be better
Yes.
on the long run?
Mhm. Yes, and I think too, what's frustrating is if you think about the mental state and the physical state of somebody that's entering treatment, and think about what we expect them to achieve in a 2-week period. They haven't they've been using, they haven't been eating, they haven't been taking care of themselves. So what they're capable of processing once they get in there is very limited. And literally, at the end of 2 weeks, you're still struggling to even handle things cognitively. And then there's also this, in addition to not having a long length of time in treatment, but I think the other challenge is that where do you go? Are you going right back where you were? Are you setting yourself up for failure? So there isn't a lot of residential support post-admission. And then on the other side of that, people at the Department of Health on the Albany level are really trying to get people treated in an outpatient setting. Well, we don't have those kind of supports here in a rural setting, like a sober day or a recovery center where somebody could spend a day and be with people that are trying to stay sober. They're many times here, and you just have like a self-help meeting that you might not be able to drive to. So I think that's the trouble, in addition to them not following through with it.
Thank you.
Pat?
Yes.
I would just like to say, so that's a very valid question. At DSS, we will see a lot of people come out of inpatient, their 2 weeks stay, and then they can't go back to where they were because of the incidence of drug use, so they may end up in our shelter or in a hotel or motel while they're waiting to get into the 3/4 or halfway housing. And of course, then they're likely on public assistance in order to afford that halfway and three-quarter way housing. Because as Pat talked about, how debilitated the individual is, they're not in a place where they're really capable of work. Their work is treatment and getting healthy for a while. So we have had people in three-quarter and halfway housing for more than a year. So, but those are the ones that are getting out and able to remain sober while they're waiting for that next placement. And that's a hard period of time for people, is that break and going back to outpatient and trying to maintain.
Because it's quite a jump. I mean, when you
It's a
go
jump.
from a 24-hour recovery environment and you're living in an apartment and suddenly you're down, you might be going to 4 hours of treatment a week. That's a big leap, especially if you don't necessarily have a healthy support system.
So is the age group with this drug problem the same as it was, all ages?
All ages.
No, not defining a certain age. I think there was an overdose in the town of Craig. I don't know if it was yesterday or the day before. How did that down?
I
I don't know either. I know they gave Narcan, that's all.
Yeah. Any other questions?
Ben, I noticed where you had on your threads there, the legalization of marijuana. If you listen to the news media and read stuff in the paper in the last week and a half, there's people that would put that over on opportunities. So that's gotta be even beating you down more. I mean, it's ridiculous to what's going on out there. These are people who I would say are pretty decent people, calm thinkers and stuff like that, but I mean, it's, you know. And the other observation, I happened to sit at lunch one day with a young lady, within the last year, I think, and she'd been 3 times in and out, and she had seen the light. This was a Tuesday. She OD'd on Wednesday. Yeah. I mean, it's just like that. If you'd have talked to her, you'd have said, you'd have relaxed, you'd have let your guard down, everything was fine, so it's gotta be done.
All right, well, thank you.
Hey, Pat,
Maybe your clicker to Ashley.
I see you're looking for people on your subcommittee. Who are you contact?
Me.
You got a couple people that are really interested.
Oh, good, that would be awesome. That would be just awesome.
Okay.
You sit and make it sure.